So mistake number 9, incorrect VA billing. So we put this in here because we have noticed a lot of our acupuncturists, dietitians, and chiropractors, and even our medical massage therapists, they all take VA now or want to. In the past, VA was very difficult to deal with, and they took a very, very long time to pay. We're talking upwards of 6 months to 9 months to pay you. Now they actually improved that system, and if you're doing everything properly, you're paid within typically 2 weeks of your billing going out for your services. So if it's something that you've been thinking about doing and trying to get in network with your local VA, they do pay pretty decently for your services. And if you're trying to grow your practice, this is a good way to do it. So your first thing you want to make sure is that you know which providers can bill the VA, or how you're contracted. Is it your group that's contracted, or is it individual providers within your practice that hold the contract with VA? Because they will deny your claim if you send it as a group under your group NPI, but it's only you as a provider under your individual NPI that's contracted, and it's not your group NPI. They will deny it for that, basically saying, we don't know who this provider is. So making sure you know who can bill the VA and how you're contracted with them. A way you can check for that is it's right on the authorization that they send you over, approving your services and telling you what you can do, how many visits are approved, how you need a bill is on that referral too. So that is your easy way to kind of look to see how the VA has you down and being contracted. And that goes right into the example here of knowing what codes you can actually bill for, again, under your specialty and under the rules of your license, according to the AMA and CMS, which is Medicare. How do they see you as a physician, and what can you bill? So an example of this is our massage therapist, right? You can bill for your massage therapy using a couple of codes with the VA. However, you cannot bill for office visit codes if you're a massage therapist, because those don't follow guidelines for your massage therapist. The VA may make the mistake in paying you for those, but they will come back. We did have a provider before he came to us. He had massage therapists within his practice, and the VA were paying him for those office visit codes. Guess what? 3 years later, they started recouping all of those paid office visit codes because they weren't supposed to be paying him for those. So unfortunately, there was no way to fight it because the guidelines clearly state that massage therapists, as it stands today, cannot make those medical decision making or diagnose a patient, which is what is required to use office visit codes. So he had to pay back thousands of dollars, and they went back 3 years and did an audit through all of those patients. So making sure, even though it's on your referral, is it in your license? Are you following the guidelines to make sure that you can actually bill everything that is listed on that VA referral? They're going to put it there because it's just kind of what they do. It's an automation that they do. They just click, 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 and everything is on that referral. It's up to you. They expect you to know the guidelines to be able to bill it. As far as documentation goes, because you will have to send in your documentation to the VA. Typically, you're sending in your first visit, your 6th visit, and then if you want additional visits after the 12th, I say the 12th because usually that's how many VA approves at one time. If you want more visits to try to get approved, you have to send in another form along with notes for everything, all your dates of service to prove that the patient needs more. So making sure your I's are dotted and T's are crossed in your documentation with how VA likes it to be done. If you're not sure, look at your Medicare guidelines under your specialty and what they require, and VA follows very closely to that. Mistake number 10. Now we're going to move on and talk about Medicare billing. So for Medicare, unfortunately, right now, my acupuncturist, you are not able to bill under your license directly to Medicare. That is, I will let you know right now, that is in the works. There is a big conversation happening to try to get our acupuncturists being able to bill and contract with Medicare directly. Unfortunately, it's Medicare. We have no government. We have no idea how long it's going to take for that to pass, but it's just a matter of time. And there are a lot of people on your side in associations that are battling for that to happen for you guys, because you should be able to. But moving on to my chiropractors and dietitians, if there's any dietitians here, you are able to be a provider. There are specific types of providers that you can choose to be when you sign up to be a Medicare provider. A lot of people don't know that there are different types that you can choose to be. Your first one is a non-participating provider, which basically just means you are accepting Medicare patients. You're going to be able to send their claims for them. Medicare will pay you a part of what your fee is. However, being a non-participating provider means you can actually charge the patient more than what is allowed by Medicare, because you are not agreeing as a non-participating provider to the fees that Medicare has set. Now, you do want to make sure you get the proper paperwork signed by your patients so they understand what kind of provider you are with Medicare if you're not an actual participating. So that's your first type that you can be with Medicare. Your second type is being a participating provider. That means that you've agreed to your Medicare rates and they're allowable, and you will not charge the patient over what Medicare tells you that you can or can't. And then, of course, your secondary will follow suit with whatever Medicare says is going to be covered, and that's all you can do. If Medicare has an annual deductible, it's relatively small considering what your other deductibles are, that you collect unless your secondary is a Plan F, and then they cover it. Other than that, you are only able to collect or take what Medicare is going to pay you if you're participating. Anything that services that you do that are non-covered by Medicare, and you know that they're not covered, making sure that you have your patient signed their ABN form. This is a legal document that has to be signed if you are collecting any additional money from your Medicare patients. It's your advanced beneficiary notice. It is, if you don't have it, you haven't been using it, start using it if you're charging your patients for anything in your office. It's available on cms.gov. Just type in your ABM form and it'll be there for you. You can start using it. Your third part of a provider you can be is what's called a opt-out provider. This is a contract that you actually do sign with Medicare saying, I don't want to be a part of Medicare. I have no interest in seeing Medicare patients unless they decide to come to me. I don't want to have anything to do with it. That is a 2-year contract that you're signing with Medicare, and that is you're just not interested in at all being any type of provider with Medicare. You cannot change your mind for 2 years. You have to wait that 2 years until you can go back to Medicare and say, I changed my mind. I want to be a non-participating or for participating, and then start your process with Medicare then. When you're an opt-out provider, you can charge patients if they're Medicare and they still decide to come see you. Make sure you tell them and have them sign a form. I am an opt-out provider with Medicare. I cannot send your claims in, so you are responsible for however much you can do their self-pay rates or whatever you decide to do financially with those patients. But They have to sign a form saying that they understand that you are an opt-out and will not be able to send any type of claims. So the reason why that's important is because in order to send Medicare claims, you have a special number, which is called your PTAN, or Provider Transaction Access Number. That is how Medicare identifies you in their system. You will get that number if you're a non-participating or a participating provider for Medicare. Otherwise, you don't have that number. If you do not have that number, you cannot send claims. You can't call Medicare about a patient or find out information from Medicare unless you're trying to contract with them. So that number is very, very important. When you are a provider and you do have that number, if you have a question about anything, even if it's about claims, if it's about your who your person is that they're allowed to speak to, is it you? Are you the administrator? Was it an old office manager? Do you need to change it? They won't talk to you about anything unless you have that PTAN number when you call them. So make sure that that number is very important. Do not lose it. If you're thinking in your head right now, I have no idea where that number is. I didn't even realize I had a number like that. Check emails, check your mail or files, however you used to do it. It will be on your welcome letter to Medicare. They do send in emails right now. If you have a login to your region of Medicare that you're in, there, it's very important that you do know that number. Otherwise, you'll have a very hard time calling Medicare to get that number when they won't talk to you without that number. So making sure you always keep that handy for yourself.